Hi, my name is Dr. Ilya and I'm excited to be here today. I'm a diplomate of the International College of Applied Kinesiology. A diplomate of the International College of Applied Kinesiology is a specialist at treating the underlying causes of people's health concerns. They specialize at diagnosing why a person is having the health concerns that they're having, and then getting to the root causes of those health concerns. It's a whole special system for diagnosing and treating. We will talk to you more about this on another video if you keep watching. So again, my name is Dr. Ilya Skolnikov. I'm excited to be here. Today we're going to talk to you about acne. So there's always three causes of acne. There's a structural cause. The skin is one of the main structures that's not working properly. And then there's a chemical cause, meaning there's something happening within the body that has to do with the air the person's breathing, the water that they drink, the food that they eat, maybe the personal care products that they use, maybe something having to do with their internal physiology, and those are chemical causes. There's also ways of treating these chemical causes with herbs, homeopathy, prescription medication, and nutritional supplementation, as well as flower essences. I just mentioned homeopathic remedies. And then there's an emotional cause to acne. Sometimes the issues are in the tissues. So I had acne, really severe acne as a child, and that's the reason why I got started as a chiropractor, studying chiropractic. Because nobody was able to really address the causes of my acne until I went to see a really, really well-trained functional medicine doctor like myself. So I was frustrated. I was really frustrated. I mean, I was beyond frustrated because ever since I was around maybe 14 years old, my skin was breaking out. So at first I tried benzoyl peroxide. Then I tried the Stridex pads. Then I tried the tetracycline, right? I tried all these different things. I even tried salicylic acid, and I think I might have mentioned the Cleocin T and the Retin A, and finally I used Accutane. Accutane worked, but I was just tired of having 5 or 6 eyes, craters on my face, not being able to date anyone. And when you're 13, 14, 15, 16, 17, 18, 19 years old, you want to be able to go on dates if you're a fairly sociable person. And for me, it was difficult. So when I finally used the Accutane, it worked, but I started having floaters that I was seeing in my eyes that I didn't see before the Accutane. And I started getting angry all the time. My face got really flushed and my skin got really dry and it would start to flake, and I was told I couldn't go out into the sunlight, and it even mentioned that this will cause birth defects in pregnant women. And of course I'm a male and I was 19 and I hadn't even studied anatomy. It said on the package, may cause permanent liver damage. I didn't know exactly what a liver was or what it did, so how would I know that that was an issue? This was not right, okay? So finally, when I took the Accutane, my acne did go away, but then I started getting angry all the time. I just started yelling at people. I wasn't able to think clearly. I ended up having chronic fatigue syndrome, irritable bowel syndrome, really severe, leaky gut syndrome, where I was having diarrhea and just having to go to the bathroom 5 or 6 times a day, number 2. And it was just terrible. If you know or have ever met anyone, or you experience chronic fatigue or fibromyalgia, you'd know that this is a terrible, terrible thing to go through. And so I was looking for solutions. I was frustrated. I was upset. I was angry. I was annoyed. I was getting depressed. It was really bad, okay? And even though my skin had cleared up, now I was having all kinds of problems. Because my liver was toxic, and I'd had a toxic colon for a long time, the muscles that I learned about as an applied kinesiologist later, the muscles that are related to the liver started to not work properly. Those are these pec major muscles, the ones that men like to show off when they go to the gym and exercise a lot. I tore one of those muscles lifting weights. The surgeon said he'd never heard of such an injury before. But the surgeon didn't understand that the pec major sternal division is related to the liver. And the main emotion of the liver is anger. And that's why I was yelling all the time. That's why I was so angry. I mean, I had this girlfriend and I started yelling at her all the time. And that doesn't work for a relationship, of course. And also, I was starting to have bad, low libido. Like, I couldn't even have sex properly. And I was only 21 years old. I was sweating at night. I was having female hormonal imbalances, which is the same thing I specialize in helping people with now. Hormonal imbalances, female hormonal imbalances, male hormonal imbalances. So this is just a quick intro. If you're interested in getting rid of the entire cause of your acne permanently for good and forever, and the thing that caused the acne, we can help you. Just go ahead and go to the thing that's asked for your name and email address. It's over there, or over there, and over there, or maybe it's right down there. There should be like an arrow, most likely, and then a box where you could put that in. It might even ask you for your phone number. Just fill that out, and we'll get in touch with you, and we'll go through a quick exam. It takes about an hour, maybe less time, and it'll be thorough enough for us to understand what's the pattern that's led to your acne and how we can help you, like somebody was able to help me. Because if you're not wanting to go to a bunch of dermatologists and a bunch of different doctors and try a bunch of different medications that may treat the symptom but not the cause, then I don't want you to go through what I had to go to. So fill out the form and we'll see you in the office soon. Thank you.